Good afternoon, everyone. Thank you for joining us. I'm Steve.
I'm Scott.
And together we're Backyard Musings, People's Republic of California.
And this story that we're talking about this afternoon is a little bit more on the believable side than the one we talked about this morning.
It sounds really familiar, like we talked about it once before.
Well, we've talked about issues with this that relate to this, but this is a good story.
A chemical commonly found in consumer products and used in dry cleaning has been shown to triple the risk of liver fibrosis. Liver disease is most often linked to three main causes: heavy alcohol use, fat buildup in the liver associated with obesity, diabetes, and high cholesterol, or infection with hepatitis B or C. That's 5. It's not 3, that's 5. However, new research from Keck Medicine of USC, published in Liver International on October 16, 2025, suggests that another culprit may be at play. The study confirmed tetrachloroethylene, PCE, a chemical, I've heard of PCE, a chemical commonly used in dry cleaning and present in everyday products like craft adhesives, stain removers, and stainless steel polish, as a potential threat to liver health. Would you like to know more?
Yeah, this is kind of fascinating. So, the findings reveal that people exposed to PCE had a 3-fold higher risk of developing significant liver fibrosis, a serious buildup of scar tissue that can progress to liver cancer, liver failure, or even death. The study also showed a clear trend. Greater exposure to the chemical corresponded with a higher likelihood of severe liver damage. Quote, this study, the first to examine the association between PCE levels in humans and significant liver fibrosis, underscores the underreported role environmental factors may play in liver health. This is according to Brian P. Lee, MD, MAS, a hepatologist and liver transplant specialist with Keck Medicine and lead author of the study. Going on with the quote, the findings suggest that exposure to PCE may be the reason why one person develops liver disease while someone with the exact same health and demographic profile does not.
They must get their clothes dry cleaned a lot.
Maybe so. You know? Or they work in a dry cleaning facility a
sweatshop. Yeah. PCE is a human-made colorless liquid used in dry cleaning. It has no odor. It has no taste. And wasn't that the Princess Bride? What was that poison called? I can't think of it. Okay, anyways, I digress. Household goods and industrial settings to remove grease and for other purposes. Well, that's a catch-all. People are typically exposed to PCE through the air. For example, the chemical can be slowly released into the air over time from clothes that have been dry cleaned. PCE can also be present in drinking water from contaminated sites due to spills and improper disposal of PCE that can seep into the soil and then into the groundwater.
So if you get your clothes dry cleaned and you wear them all the time, like I know law enforcement, they get their clothes dry cleaned.
Military.
And they're in those things every day, right?
Well, not now because the military is not getting paid, but
military. Military or people that wear suits all the time get those dry cleaned. So be on the lookout for this.
I get my dry cleaned for church shirts.
Oh, you get your shirts dry cleaned?
Yeah. You don't?
No.
Oh my gosh.
Yeah, I wash them.
I wash them too, then have them press them.
Oh, okay. The International Agency for Research on Cancer has classified PCEs as a probable carcinogen and linked to to bladder cancer, multiple myeloma, and non-Hodgkin lymphoma. All not good. Other studies showed that exposure to PCE increased the risk of liver cancer, said Lee.
He's a bad dude, man.
Yeah, why aren't they outlawing this or finding a different way to do that?
Skull and crossbones on it, Yeah. Due to its toxicity, the United States Environmental Protection Agency has launched a 10-year phase-out for the use of PCE in 10 years? The use of dry cleaning, as well as banned or placed workplace controls on other uses of PCE. However, the chemical may remain present in some applications and in countries without similar regulations.
So if you go overseas or someplace, third world country, and you get your
clothes dry cleaned.
Yeah, I don't even want to think about it. Lee and his fellow researchers used data from the National Health and Nutrition Examination Survey, a nationally representative survey of the United States population to reach their conclusions. They tracked PCE exposure through the concentration of the chemical in individuals' blood in people 20 and older from the years 2017 to 2020, the most recent years for which information is available, finding that some 7% of the population had detectable PCE.
That's way too much.
It is.
Wow.
Then they examined which individuals with PCE in their blood had significant liver fibrosis and found that people exposed to PCE were 3 times more likely to have significant liver fibrosis than those without exposure. That's not good.
Yeah. These results held steady independent of factors such as age, gender, race, ethnicity, and education level. The study did show that those most at risk of PCE exposure were from higher income households. So we're not going to know what is the exposure to non-cis, or what do they call those, ghost? They identify as ghost. No?
Casper. I don't know.
Yeah, we're never going to find that out because it's only done on two genders. Quote, people with higher incomes may be more likely to use dry cleaning services, which could increase their exposure to PCE, said Lee. However, people who work in dry cleaning facilities may also face elevated risks due to prolonged direct exposure to PCE at work.
Not good.
Oh.
The researchers also found that for every 1 nanogram per milliliter increase in PCE concentration in the blood, and of course 1 nanogram is 1 billionth of a gram, which is pretty small.
Yeah.
The individual's odds of having a significant liver fibrosis increased 5-fold. Of particular note, alcohol use and fat buildup in the liver linked with obesity and other factors did not appear to play a role in significant liver fibrosis when PCE was present. Quote, patients will ask, how can I have liver disease if I don't drink and I don't have any health conditions typically associated with liver disease?
Fair question.
And the answer may be PCE exposure.
Lee would like to see future research in the field of environmental toxins and how they affect liver disease. Quote, no doubt there are other toxins in our environment besides PCE that are dangerous to the liver, he said.
He also thinks the study may lead to improved outcomes for patients. Quote, we hope our research will help both the public and physicians understand the connection between PCE exposure and significant liver fibrosis. Going on with the quote, if more people with PCE exposure are screened for liver fibrosis, the disease can be caught earlier, and patients may have a better chance of recovering their liver function.
Yeah. That's is it the kidney or the liver where they put blood in? That filtrates the
kidney.
That's a kidney.
It's a filter, right?
Yeah.
Filter.
Yeah.
Well, it's part of the filter. I think the liver and the bladder all do filtering too, I believe. But yeah, my father-in-law passed away from liver cancer, and he'd been on a really tight study and trial where they were checking him all the time for liver cancer, and then all of a sudden it just popped up.
Boom.
And 6 months, they gave him 6 months, and about 6 months he passed.
You can't take the liver out, and
he didn't want to do anything. He didn't want to try to fight it or anything, just let it take its course. But stuff like this, because we know people. I could name somebody right now that had some liver issues in the last 4 or 5 years, and you'd recognize his name. And he never drank, lived a good life.
Maybe he worked in the dry cleaning.
Not dry cleaning, but he worked in another industry that, maybe that was the case. Maybe this PC thing was part of the deal. So anyway.
Yeah, not fun.
Yeah.
All right, folks. Thanks for joining us. We'll catch you in the morning.
Take care, everyone. We'll see you tomorrow. So